All right, I got to get on my soapbox a little bit about this pathological label, hypoactive sexual desire disorder. This is a diagnosis in the book that we use to diagnose people's medical and mental health conditions, as if lack of desire is a disorder that you could treat theoretically with medication or something like that. So the definition, it's a condition characterized by persistent or recurrent lack of interest in sexual activity resulting in significant distress or interpersonal difficulties. Well, while certainly get all the time that a lack of desire creates distress and interpersonal difficulties. I work with couples with libido differences all the time. This is missing the point because the person that is struggling with lack of libido has legitimate obstacles in their way. There can be things just about them that they have brought into a relationship: trauma, body image issues, depression, anxiety, the medications that they're on, diseases, exhaustion, things like that. This doesn't mean it's a disorder. It means this lack of desire makes sense. Then there's the stuff about your relationship. Who's going to want sex if you're fighting with your partner, right? If you're not getting along, if you're having power struggles, if you're um, you know, not knowing how to communicate effectively and things are getting escalated, if there's contempt or criticism, right? The lack of desire would make sense for people. Then we get to things about the sex itself. Are you getting what you need? Are you getting enough time and touch and foreplay to get in the mood? Um, are you doing things in sex that you like, or are things happening that you don't really like or that are turn off? Right? Um, do you have different expectations in your partner about what's supposed to happen? There can be real struggles that are going to block your sexual desire and potentially your pleasure and your responsiveness. And then there's larger life stuff, money concerns, children, concerns about politics or the environment or safety and all kinds of stuff like this. There are so many things that can block a desire for sex. Sometimes I'm amazed that people have sex at all. It can be so fragile. Now, for some people, it's when they're stressed out that they want sex more. Sex is a stress relief. So that's, all of that pile of stuff can actually make them seek sex. But for a lot of people, this gets in the way. It throws on the brakes. It's creating barriers to desire. So none of this is a disease state, okay? You are not broken if you're struggling with lack of desire. Your partner is not broken if they're struggling. I can't stress this enough. It is not a problem with you. You are not inadequate. You're up against real struggles, and I get that it's having an impact. But there's so much you can do about those obstacles, and there's so much you can do with your partner to approach sex differently. The other thing that is totally missing in this conversation, this idea of HSDD, is there are two different ways to experience desire. So one of them I call proactive. So that's where it comes over you like hunger spontaneously, right? You're thinking about sex, you're in the mood, you're horny, you want to seek it out. This is what we think of as libido. I think this is what we see in the media, on TV shows and movies, right? This is what we expect to feel. This is how we think it's supposed to work. So when we don't have that, or our partner doesn't have that, we think something is wrong, right? We label it as a pathological disease, a disorder. But the truth is, there's another way to have desire. It's what I call reactive. So you got proactive and you've got reactive. So reactive is where somebody is not in the mood at all. They are not thinking about sex. It could be the last thing on their mind. If you ask them if they want sex, they probably rather read their book or go to sleep. But if they start, and if they get what they need, the connection with their partner, the time they need, the touch they need, maybe they get into their body. Maybe their body wakes up. Maybe they end up getting aroused. Look at that. Now I want to have sex. This is not broken. This is not a disorder. Reactive desire is valid and it is common. It is normal. Nothing is wrong with this. I am never trying to fix this in my sex therapy practice or my course. We have to accommodate it differently. But hypoactive sexual desire disorder makes it sound like this is a problem instead of just a normal experience for so many people, and not just women, by the way. So having to start at zero and not know yet if you're going to get in the mood is common. It is not broken. It is not something to fix. So I am just sick to death of labeling people with low desire as if they are broken, as if they have a disease state, as if this is something we could treat with pills or something like that. It's so much more complicated than that. And there is a way to access it. So if you're listening to this, you're already in my program, you've got all kinds of resources, right? If you're not, if you go to desirediscrepancy.com, I have secret or like private podcasts for both higher desire people and lower desire people. I have a webinar about how to bridge these gaps. Please check out my resources, and I really hope it helps.